Tuesday morning, November 14th, 2023. Welcome to the next edition of our VETgirl YouTube live webinar series. Super excited to be here with Dr. Julia Miller. We're going to be talking about improving client communication and compliance in your long-term dermatology cases. And we know they can certainly be long-term. I wanted to say hi. My name is Garrett Pachtinger. I'm the co-founder of VETgirl. I am logging in from, as I look out my window, fairly nice and sunny Pennsylvania, a little bit cold, but my guess is not as cold as Justine. Justine, what about you? Where are you logging in from today?
Hi, everyone. I'm Justine. I'm an emergency critical care specialist and toxicologist based out of beautiful St. Paul, Minnesota. And it's actually unseasonably warm. It's a beautiful 60-degree day before winter comes. So I'll take it.
Wow, I may need the jacket here. You're probably in shorts and flip-flops, as Minnesotans love that 60-degree weather. Dr. Miller, what about you? Where are you logging in from?
Yeah, I'm in the land of bourbon and horses in Louisville, Kentucky, and it's gorgeous here today, too. I can't complain.
I have to say, I'm now jealous of both of you. You have warmth, bourbon. I mean, come on. I'm stuck here in Pennsylvania. Maybe I have an IPA or two or a lager. But I think you're both of you in a little bit of better shape than I am. As you all know, if you've been on our VETgirl YouTube live sessions with us before, we love knowing where you are logging in from. So please, in that comment section down there, please go ahead and type in. Dr. Miller, I told you Portugal is being represented. I told you that was one of our best and most fun countries that we have here. We have Canada. See, I told you we are international. I did warn Dr. Miller that we have such a great audience that attends our YouTube live events. So thank you all for being here. Please go ahead and type in where you're logging in from. We certainly love seeing it. As I go through a little bit of housekeeping, first of all, we want to give a big thank you to Blue Buffalo for having Dr. Miller give this session today. You all know that we've always promised when we have the benefit of an amazing educational partner like Blue Buffalo, we are certainly happy to provide completely free, complimentary, race-approved CE. So thank you to Blue for being here with us for an amazing session and helping us bring this important information to you all around the country and around the world. As I said, this is race-approved. How do you get your CE certificate? There are two ways. You either need to fill out the form using that website URL. So it's tinyurl.com/VG for VETgirl, and then 11/14/23, which is today's date. Or you can use your fancy smartphone, use that QR code photo functionality. It takes you to that same form. We are going to keep this form open until 1 p.m. Eastern, which is 30 minutes after the session ends. So please either type in that website address or use your fancy phone QR code capability to fill out that form. Usually within a couple of hours, your CE certificate will be found in your VETgirl account dashboard, which means you must use, even if you're a non-paid trial-free member, please use your email address associated with your VETgirl account. That's where we will put your CE certificate. So with that said, as this is YouTube Live, you all know that bottom little box in the corner makes your YouTube video the full size of your screen for best viewing if you don't want that smaller YouTube screen picture. We do hope you're interacting with us with our certificate programs. We now have, let's count them, 11 active and live certificate programs. It's a great way to level up and completely free as part of your VETgirl membership. If you don't have a VETgirl membership, check us out. You get 14 days to watch our content, see what we're like, see how we do things. We hope this is a great representation as well, but you are eligible if you've not been a VETgirl member before to get a 14-day free trial membership. And if you have not heard, we are super pumped and excited. VETgirl U 2024 is going to be in amazing New Orleans. So don't delay. We are an early bird right now. The best pricing is available for the conference, as well as our two master classes. We have an anesthesia and analgesia master class and an elective neurology master class. You can sign up for those as well. With that said, I know you're not here to listen to me or Justine for that matter, at least not today. We are here to listen to Dr. Miller. So Dr. Miller, again, we know you are in the land of Kentucky and bourbon, but give us a little bit of a background, who you are, what you love to do, and then please take it away. The floor will be yours. And again, thank you so much for being here with us today.
Yeah, thank you guys so much for having me. I'm really excited. So I'm a horse girl by birth and love. And after vet school, I went to Cornell. I did a large animal internship, but then I moved on to mixed animal general practice. So I crossed over to the dark side and did a lot of small animal work as a GP for a few years in North and South Carolina, as well as Virginia. And then my love of all things gross and crunchy brought me back to dermatology. So after about 4 years in general practice, I did my dermatology residency at Cornell. I stuck around and taught there for a few years, but now I'm in private practice as a dermatologist. So I love to talk about all things crunchy and gross as far as skin goes, but I also really like to talk about communication because that is such a big part of what we do in our dermatology cases. So when we start talking about communication, I know that many of us kind of feel like Adele does in this picture. By the way, if you ever get to see Adele in Vegas, chef's kiss, you should 100% go. It was the best day of my life. But when we think about our dermatology cases, I know a lot of us kind of think, oh God, it's another itchy, scratchy dog. What am I going to do? I'm going to have the same spiel over and over again. And then I don't know if I'll be very successful. I'm hoping by the end of this short conversation that we can have, that you will leave with some tips and tricks on how to speak to your clients about their derm cases. Because when we have good, clear communication, we have much better patient outcomes. So this is a little saying that my dad liked to say, and I firmly believe it, right? Derm cases don't die, they just smell that way. So I'm not going to talk about referral in this particular webinar, but I do want to make a plug that, a lot of people are open to referring ophthalmology cases because if you tinker around, the dog could lose an eye, and that's a big problem. But don't think about your derm cases any differently. These patients can be stinky, smelly, scratchy. It can be very difficult for the clients to live with, love on, and take care of their pets. So that human-animal bond is so important. And in derm cases, it can be very stressed just because of the nature of allergies and whatnot. So just because we're not dealing with, an eyeball coming out doesn't mean you should approach these cases any less seriously and any less clearly for the client. So even though they smell terrible, and even though they ain't gonna die, we want to make sure that we're very tough on our derm cases and we make sure that we're treating them appropriately. So let's talk about, I gave you 10 tips here, and let's start off right off the bat. Number one, I want you to set your expectations. If you want to set them low, set them low. Honestly, I kind of did that in general practice all the time. I said, here's the bar. If I meet it, that's great. If I exceed it, even better. But you want to set your derm expectations from day one. When you get that Labrador that walks in with an ear infection in June as a 1-year-old, that's allergic. We all do. So when I talk to that client, I don't just send it out the door with some Otamax. I also spend an extra 5 minutes saying, by the way, Gunner's an allergic dog. You're probably going to be back here. We are going to be lifetime friends. And the biggest thing I want to tell you now is this is a single ear infection. But here's the things I want you to look for. Is he itchy? Is he scratchy? Does he lick his butt? Is he scooting? Give them the tools to see for what to expect for an allergic dog, and do that right off the bat. Day one, right? Don't just swoop in and say, here's your Otamax, bye. Spend the time on that appointment. I also try to tell clients every single time and right from the get-go that rechecks are going to equal success, right? And we'll talk about rechecks more. I recognize that that's one of the hardest things to get in general practice. It's hard for me to get rechecks back in too, but become a broken record when it comes to talking about rechecks, and that can be very helpful for you. I'll bring up finances, right? What I tell clients all the time is money is very real. I 100% get that. We all have certain finances, and I'm here to support you in what you can do with your finances. So right off the bat, I might say to somebody, get yourself a little savings. Your dog Gunner is probably going to see me a lot, and he's not going to be a cheap boy to have. So let's start planning for that and thinking about it now. And then I don't say the C word in dermatology very often, cure. Right? So everybody wants you to come in, chuck a medication at it, and that's it, and you move on. I think it's very important when you set your expectations to say, look, there's going to be issues. There's going to be flares. This is a lifelong disease. Just because we have lifelong problems doesn't mean we're not being successful. We are managing this dog as best we can, but derm cases are management, not cure, but management. So when I talk about expectations, I also want you to know that atopic dogs will flare. So on the next slide, It's important to remember, right, that even if you are a derm rock star, like I am, even if Apoquel has worked incredibly well for the last 3 years, even if this is your favorite client that comes in for every recheck and does everything you want to a T, every atopic dog is going to flare. And that does not mean that you are not a good doctor. It does not mean that you're not being successful in your management. And I think it's important that you tell this to clients specifically. Like, this fall was horrible in Kentucky, truly horrible for allergies. And I had clients come in and they're like, well, he's flaring again. What are we doing wrong? And I had to communicate with that client and say, no, we're not doing anything wrong. We have done a brilliant job managing Gunner. He's been great. It's just that the ragweed has gone absolutely crazy this fall, and every single one of my patients is flaring. Here's the good news. We can go ahead and treat this flare appropriately, get him over it, and then get back into our good maintenance that you've worked really hard for over the past few months. So part of communication with allergic dogs is knowing that you don't, what's the word I'm trying to look for here? Don't say that if there's a flare, you failed. Flares do not equal failure. Flares are going to happen, and you just need to know how to treat them appropriately. So the other thing that I think you should mention right off the bat, right? I'm sure a lot of you are talking about pet insurance with your patients. I talk about it almost daily, to be honest with you. Now, unfortunately, by the time they come to me, the cat's kind of out of the bag. A lot of insurance companies are going to consider these conditions pre-existing by the time they hit my door. But you, as the first line defense, you as the general practitioner, you have an opportunity with that first ear infection Gunner has, which he's gonna, you have that opportunity to say, by the way, do you have insurance? You should think about it because you probably have an allergic dog and you're gonna spend some money on him. So I absolutely recommend insurance. And I think that you opening that door up early in these patients' lives can be very, very helpful. Second thing to think about, and honestly, to me, I think this is the most important aspect of communication about dermatology cases. I want you to be open, I want you to be honest, and I want you to be understanding of your clients. When I say remove the stigma and blame, what I mean by that is, let's talk about shampoos, right? Shampoos are amazing. Medicated shampoos can do a world of good for a dog. But if the client isn't going to do them or can't do them, that's okay. We have to get over saying you have to bathe, and if you're not bathing, you're not doing enough for your dog. Absolutely not. Y'all, I'm a dermatologist and I own 3 allergic dogs, and I am terrible at bathing them. I'm genuinely awful. Does it make me a bad person? No. Does it mean that I don't care about my dogs? No. It's just not what's going to happen in my lifestyle. And I am very honest with clients. I have clients come into me and say, I'm bathing sometimes. And I'm like, be honest with me. Can you bathe? And if the answer is no, girl, I get it. I can't bathe my dogs either. I don't do it. So when you remove that stigma, when you are compassionate and empathetic towards what they can and will do, that is going to make you create a stronger bond with your client. And it is also going to make you more successful. Because if you keep prescribing things that the client cannot or will not do, you've literally wasted their money. They think you've wasted their time and money, and the dog is not going to get better. So remove that blame. Say, hey, I get it. You can't give pills to your cat. I like my fingers too. I couldn't do it either. And then you as the doctor need to take that moment to pivot and come up with a different treatment plan. But that requires very open and empathetic communications with clients. I want you to remember also that budgets are real and budgets are acceptable. Y'all, Apoquel and Cytopoint are glorious drugs. I use them every single day. There are absolutely clients out there that cannot afford them. And you know what works for those dogs? Steroids. And are steroids affordable? Yes, they are. And what did we use before Apoquel and Cytopoint? Steroids, right? So please don't blame a client. Please don't make them feel like they're not being good towards their dog or not caring towards their dog, because you have to use steroids for maintenance because that's all they can afford. Our job in dermatology is to try to work with the client and the patient as much as possible. And again, take that stigma away and say, hey, man, I get it. If prednisone is what you can afford, I'm going to do my best to figure out a plan that makes prednisone the safest it possibly can be for Gunner. And then we can move forward with that. I get a lot of clients that come in and just say, that's it. I'm gonna euthanize this dog, or I'm going to take this dog to the shelter because I can't afford Apoquel and I can't get steroids anymore because they're too dangerous. And to be honest with y'all, if you use steroids at a low dose, dogs can live many long lives, long years of life on steroids if need be. I think it's also very important that you always work with your client, discuss with them what will work for them. And then as far as being honest, I'm always honest with clients and say, hey, sometimes this is trial and error. I'm going to try Apoquel, and if it doesn't work, we're going to try Cytopoint. And if it doesn't work, we're going to pivot and we're going to do something else. So I think it's very important that you set the expectations that sometimes derm is trial and error. Another thing that's really going to help you with your client compliance mostly is the KISS principle, right? The keep it simple, stupid principle. It's very important that you try not to overwhelm. Now, if you see my discharges, I've got like 8 medications on there, and sometimes that hurts my soul because I know how difficult that is, but I'm seeing the top tier cases that are the most difficult, right? When you're in general practice, the more simple you can keep it, the better for your client. Instead of sending them out the door with an ear cleaner, an ear treatment, a shampoo, a mousse, and 3 different oral meds, they're not going to probably do all of that most of the time, right? See if you can distill that down into 3 things, maybe 4 things. And the simpler you can keep it, that often really helps you with your client compliance. Another thing I like to say, especially if there's any new grads who are on, this webinar, is that you want to kind of limit it to less than 3 differentials. Now, when you get out of vet school and you're seeing these clinical signs, you have like 400 differentials in your mind, and you're good. That's correct. You're an awesome vet, peak of your vetness right now. But if you say to a client, hey, it could be one of these 400 things, they don't see that as good. They see that as she doesn't know what she's talking about, and they lose all of their confidence in you. So try to keep it simple. I cannot tell you how many times I walk into a room and I say, hey, I think your dog is probably allergic, but we have a lot going on today. We got a bacterial infection, we got a yeast infection in the skin, and we got some ear stuff. And what I need to do today is I need to treat what I see. I need to peel the layers of the onion back, and then let's get to the root cause of this problem. So I don't go on and say, could be food, could be atopy, could be flea, could be I don't say all that stuff. I try to keep it really simple on visit 1. And then as we continue with rechecks, I'll kind of peel the layers as I go back. Do I mention allergies the first day? Yeah, I will say, hey, there's an underlying cause for what's going on today. It's probably allergies. We might talk about hormonal diseases or something like that. But I do think it's important in the beginning that you try to keep it a little simple. And then remember that when you are doing treatment plans, that they're treatment plans they will successfully complete. And that is 100% communication. And that literally, almost every single ear dog that I have, in fact, probably every single ear dog I have, I will say, hey, by the way, is that Frenchie right there in the beautiful muzzle, is Lily good for ear meds? You're very good at getting them in. Well, I can get them in maybe once a week. Okay, I'm not going to send you out the door with Otamax today. We need to work with you and figure out what works for you. And the only way I knew that is by asking a very targeted question and then being open to that answer. Because if they say, oh, maybe, I'll say, hey, I get it if you can't treat the ears. That absolutely happens. Again, let me work with you. Money, right? Money is real. This is just the reality of what we deal with in veterinary medicine. When I practiced in general practice, I was in rural North Carolina for most of the time, and then I was in rural South Carolina. So I fully recognize that budgets are real and we have to work within them. And I think, again, we're going back to the slide of removing the stigma, removing the blame. Make sure that we are compassionate towards our clients regarding what they can and cannot afford, right? But one thing that I say to all the clients is, in the end, consistent care is the most affordable. Flares are expensive. And if you've got a client that says, hey, Dr. J, I've seen you 4 times this year. Every time I see you, you give Apoquel. I stop the Apoquel. He flares. I come back a couple weeks later because he's flared. And then we go on Apoquel, antibiotics, this and more topicals. And then I stop the Apoquel. That's your opportunity to intervene and say, hey, instead of going up and down like this, and those flares are expensive, just stay on the Apoquel. And you know what? Maybe I prescribe 2 months of Apoquel instead of that 1 that I've been prescribing before. Because at least if it goes out the door, the owner might be more likely to give it. So I will bring it down to finances sometime. I will sit in this exam room that you're seeing behind me and say, hey, man, I'm not trying to waste your money, but I know you're going to be back here in 2 months and we're going to have another infection and we're going to have another ear issue. If you just stay on the Apoquel consistently, I know it's an expensive drug, but you can afford it. But if you just stay on that consistently, I bet I won't see you in 2 months. And sometimes when you bring it to finances, that can actually really help the client be more compliant in what they do. The other thing I want to say about money, and I mean this wholeheartedly, y'all, we have an obligation as veterinarians to not waste clients' money. So know what you are treating and don't send home a treatment they will not use, okay? I'm gonna try to go faster. This brings up the next thing that I think is super important. Stress the importance of diagnostics to that client. We are scientists. We are not guest workers. We are not this beautiful pug reading a crystal ball. We are scientists, y'all. We need to know what we're treating. And the way we know what we're treating is to do diagnostics and dermatology. Everyone will do blood work till the cows come home, but how many impression cytologies are you doing? It's really important that you get comfortable. And by the way, the only way to get comfortable with cytology is to keep doing it. The more you do it, the better you get, right? But you need to know what you're treating so that you eliminate that guesswork. When you are wrong, that leads to expensive treatments that weren't working. And when you are wrong, that also leads to eroded confidence in your client, which really does hurt you in the long run with these cases. So very, very quickly, because I don't want to run out of time, here's a case where, in case number one, you get an animal that comes in, it looks like a staph infection. That's what you think it probably is, but you don't do any diagnostics. So you have your $70 exam. I made these numbers up, by the way, y'all. $70 exam, $50 worth of cephalexin. So your total on that visit's $120. So they come back for a recheck because he's not better. And you say, well, I guess he's not better. The bacteria just must have been resistant to cephalexin. So I'm going to put him on VETgirl, which we could have a whole other conversation. Please never do that. But here you go. You did your recheck exam, your VETgirl, and then you had another $205. Then he comes back for his third visit and you go, you know what? I guess I got to do some cytology. My two things didn't fix this dog. You end up finding malassezia, not bacteria, on your cytology. So you treat it with ketoconazole and the dog is now resolved. Now that grand total just for cash is $470. That does not take into concern the work missed and the time missed or babysitters or things like that. Whereas if you were in case two, if you went to cytology right off the bat and that exact same dog, you would have done your exam, your cytology, and done ketoconazole, apparently spent a little more money on ketoconazole, and your grand total would have been $170. So when people come to me and say, I can't do cytology, it's not in the budget, look at these budgets. If you are correct time number one, you have saved your owner a lot of money, right? But the other thing you've saved is you've increased pet comfort, you've resolved that skin disease, and you've increased your client satisfaction. And y'all, that is priceless when we're trying to get clients who listen to us and trust us, okay? Another thing I want you to do is utilize your resources. So I use resources in exam rooms all the time. Visual learner. I love this little ear diagram, for example. If you have time, discharges are cool. I like them. You can do some nice templates. Handouts are brilliant. I mentioned clinicians brief here. I used to pilfer their handouts for clients all the time, but whatever company you may like, or if you have your own handouts, I think that's wonderful. Many of our clients are visual learners more than they are oral learners. And so having things printed out for them can be very helpful. I send handouts home all the time. There are also specific internet sites you might want to guide them towards instead of just the general Dr. Google. And then, of course, do not forget your technicians. We're going to talk about this more in just a second. So this is just a picture of a handout that DECRA has that you can give clients on how to appropriately clean ears. Most of our clients do not know how to clean dogs' ears appropriately. And anytime I'm sending home an ear cleaner, it always accompanies an in-person demonstration of how to do it. Well, also, why don't you send them home with this piece of paper? And when they say, I forgot what Dr. Julia said 2 days ago, and now they have this paper and they can remember, okay? And then last but not least on this sort of resources aspect are your technicians. Y'all, these are the unsung heroes, the backbone of our important derm cases, right? They can take you specific derm history. They're going to discuss how to administer medications. They're also going to reinforce rechecks. Let's get them at every level we can. And they're going to reiterate what you say. So please train your technicians and utilize them to their fullest because they are going to help you so much with your communication and client compliance. Now, I want to do a small plug here. I was just a part of this task force that the 2023 AHA Management of Allergic Skin Diseases in Dogs and Cats Guidelines. This just got published. It just came out in November. I'm really proud of it. But it is geared towards general practitioners and technicians. So for example, if you're trying to train your technicians on some derm stuff, have them read this. It's very clear and concise. It sort of tries to distill everything down into user-friendly information. I highly recommend this resource when we're talking about communication and training for you and or your technicians. So another thing I think that's really important, and I do this all the time, y'all, is positive reinforcement. You know, it's very easy for us to go, you stop the Apoquel, you got to keep going. But what if they do keep going? So when I do rechecks with these patients and they're doing better and the client says to me, Dr. Julia, I love you, you're great. I say, you're great. I cannot be successful unless you do what I say, and you did it. So I am like a cheerleader, like you would never believe in an exam room. When I get a Pseudomonas ear cleared, I'm like, y'all, we did it. Your hard work paid off. Thank you, Gunnar, for being such a good patient. I think it's really important that you are positive because people like that. People really cling on to positive reinforcement. And in these chronic allergic patients that can be so frustrating, y'all, when you do win a battle, when you clear that multi-drug resistant staph, when you finally do get the dog less itchy, make sure you're positive with that client because it helps them a lot. It's a cliche, right? But teamwork makes the dream work. That's just a fact, always a fact in derm, but I literally say that to clients daily. So very quickly, partially because this is sponsored, but also because I really believe it. I want you to remember, and if you have any questions, check out that AHA task force, that over-the-counter diets, even if they're made of kangaroo or alligator, or I don't even care, they are never a diet trial. They are a diet change, and that is different nomenclature. When we are talking about true food allergic animals, the only way to diagnose a food allergic animal, there's no blood testing that's right. There's no over-the-counter diets that are correct. The only way is to do a novel or hydrolyzed prescription diet trial. And it really does matter what you say here because clients are going to get that in their mind. I promise you that. And I want you to remember this about communication. I like a diet trial. I do them all the time. I love them. But they require intense communication and they are very expensive. Remember that I said, don't waste your client's money, right? If you got a client that you know you're going to send home that bag of ZD or Blue Buffalo HF or whatever, and they're going to just put chicken on top of it, you've wasted that client's money. So conversations here are extremely important, okay? Get those rechecks in. Now, this is difficult, right? But here's some tips and tricks for how to try to get them. Become a broken record. Not only do you talk about recheck, I want your technician to talk about recheck. I want your front desk staff to talk about rechecks. Make that recheck appointment during their exam. I think this is so helpful. My clients do not leave this building without a recheck exam on the books, even if we're talking 6 months out. Another thing I want to say about rechecks is if you have a chronic allergic dog, don't let the client tell you when they need a recheck. You tell them when they need a recheck. You know, if you got a bad allergic, I want to see them every 2 to 3 months. We just need to check in because clients are going to miss staph. They're going to miss yeast, things like that. But I'm going to catch it, and I'm going to catch it before it's a problem. So get those chronic allergics on routine recheck schedules, and I promise you're going to nip it in the bud a lot faster. That's very, very helpful for preventing those allergic flares. Remember that, you know, if you do your rechecks, you can tell the client we have a higher success rate, and you're going to spend less money overall. So this just talks to you. Old Benny Franklin, I say this all the time, an ounce of prevention is worth a pound of cure. If you can get those routine rechecks, if you can try to keep that dog on or cat on consistent medications without the flares, that's going to be the most effective and most affordable way for you to manage these cases. And then last but not least, I want you to remember something as doctors, because the best way to help your communication and compliance is to be correct. It's for you to choose the right treatment that works for the dog. And remember that if at first you don't succeed, don't do the same thing over and over again and expect different results. I want you to figure out why you failed, cytology, skin scrapes, you know, whatever it may be. And I want you to change your approach, okay? And that's really going to help you out a lot there. So thank you guys so much. I really appreciate it. Adele is back, and she wanted to let you know that you too can be a derm whisperer. It just takes some time. It takes empathy and compassion, but absolutely that can help you with your cases. And my allergic pitties want to say thank you to VETgirl, and also thank you so much to Blue Buffalo. It's been a pleasure.
Wonderful. Thank you so much, Dr. Miller. That was amazing. And what is it about pit bulls? I have pit bulls with atopic dermatitis. And I will say, I actually failed my food trial and got yelled at by some Australian dermatologist on my dog getting into the milk bones that my postman was dropping into the mailbox.
Mm-hmm.
So it wasn't my fault. He was just eating them out of the mailbox directly. But love the advice that you have, because again, we're trying to do everything that we can to really enhance that client communication. Now, really quick logistics. remember, you get half an hour of live CE, but you have to watch it live. So if you're watching this half an hour later, you unfortunately don't get CE. So make sure to fill out this form that Garrett just put up there, tinyurl.com VG11423. I've already put the link in several times in the chat, or just take your phone and make sure to scan that out. And again, a huge shout out and thank you to Blue Buffalo for sponsoring today's YouTube live event. Dr. Miller, that was amazing. Now, if you guys have any questions, please make sure to put them into the chat. We'll make sure to pass on not only the questions, but the feedback. And again, I just really appreciate all of you guys for attending. I know you guys are either eating dinner, breakfast, drinking coffee, and I love how international this is. We've got South Africa, we've got Chile, we've got Portugal, everywhere. So I love that everybody's learning from Canada too. So with that, again, please fill out the survey form immediately. And again, Dr. Miller, great feedback for you. And a huge thank you again to Blue Buffalo. With that, we know how precious your time is because you're swamped in the clinic doing cytology, right? On all your derm cases. And Dr. Miller, I just wanted to thank you again. And with that, we will see all of you guys at our next sponsored event. And thank you for all that you do. Thank you, Dr. Miller.
Thank you so much. Have a great day, everybody.